Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. Honestly though, the sensation of being drunk would be so disconcerting if you weren't expecting it. Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says, "I think I have caught the Down syndrome." Or when a young woman thought she had testicular cancer. I actually had pretty advanced serum sickness from strep penicillin, and the nurses told me I was not having any problems. The doc in there said he didn't know what it was but looked it up himself and said, "Yup, you do have serum sickness." It felt nice to be listened to. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema." Why? That infant never smoked a day in her life. This reminds me of when I was getting married and my husband and I were looking for a hotel to stay at on our wedding night. He called me and said he found one that had a honeymoon suite, and included in the package was strawberries and shampoo. We still laugh, almost 30 years later, at the thought of toasting our new marriage with shampoo and not champagne. The other day I had a guy come into the ED in tears because he had wrist pain, and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. RN. But my favorite was when a patient's family member rudely insisted we give her mother, who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink, because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay, then explained drowning to me. I had a woman come to see me because of abdominal pain. I spent a good 10-15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving, she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said, "No, because you're not a male and you don't have one." She just said "oh" and left. Spoiler alert, she had an ovarian cyst. Our family doctor once asked my husband if he was pregnant as she went down a checklist. They had a good laugh. Sad and long story, but to keep it very brief, lady on 4 vasopressors including high dose epinephrine was gonna die in the next few hours. Husband was convinced that epinephrine was causing the low blood pressure and low heart rate. He kept going back and forth from home to the hospital with online printouts, despite myself, my fellow, and my attending, and the nurses all telling him that this medication is keeping her alive. We looked at his first printout. It said, "Ephedrine." We're like, first of all, that's not the same medication. Anyways, I actually tell him that if I was him, I'd stay with her and that she may only have minutes left. He's threatening to sue us and he's convinced he's right. He goes home again to get a new printout, and she ends up dying while he's at home. This poor man probably couldn't handle the grief and trauma of this situation. Not a doctor, but when I was in middle school, the internet led me to believe that it burned when I peed because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. Our Hydra homies would like a word with you. I've had a lot of kidney stones over the last 15 years or so. 2 lithotripsies and past at least another 6. I can't even remember anymore, depending on the quality of the health insurance I had at the time and the state of my bank account. Sometimes I would seek treatment and other times I'd just tough it out at home with a heating pad, lots of water and profanity and tears, and whatever pain meds I had, either OTC or prescription left over from the last time. For the last one, a year or so ago, I decided to go to urgent care. The usual doctor. There was this good looking but not too bright fella that my friends and I all called Dr. McDreamy. I knew my body and knew my symptoms, so I basically just wanted an x-ray to confirm and proof of treatments to cover my butt if I needed time off work. Told the doc my symptoms and he ordered a urine test. I obediently peed in the cup and waited. He came back and told me I had a bad UT. I was like, caused by the stone. And he literally rolled his eyes and said, I guess we can get an x-ray. After I got my x-ray, he came back to give me the results. He couldn't look me in the eye as he sheepishly told me I had not one, but 2 stones this time. I called him Dr. McStupid after that. A mother who was convinced her son had familial Mediterranean fever. He did not. She was repeatedly told this, nicely of course. Yes, the child had had genetic testing by the time I saw the family. Oh, but a small percentage aren't detected by the testing. Thing is, her kid was fine. Healthy kid. Mom was just obsessed with this diagnosis. Not exactly Munchausen by proxy. She never did anything to him to make him sick, or subjected him to a lot of unnecessary procedures. But on that spectrum, she was just a really big fan of Mediterranean fevers. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a sigh about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them. The biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that SAR. I never would have known otherwise that what I was experiencing wasn't normal. For a stretch towards the end of high school and beginning of college I repeatedly had sinus infections. We're talking one every 3 to 4 months for the span of about 2 years. The nurse I got initially told me not to believe everything I read on the internet and to stop googling my symptoms, just for my doctor to come in about 2 minutes later and say, so you have another sinus infection, knowing I was going to be right, without her checking. Off topic, but I have a patient right now who has been intubated in the ICU for a couple days after evacuating around 2L of pus and peeling off hardened pus from her lung, after trying to treat her pneumonia with healing crystals. Sucks. Has a really wonderful family and group of friends. She's slowly getting better though. So this is why you haven't been putting out new albums. I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals and told the doctor I was positive that it was either ringworm or scabies. They told me no, definitely not, and prescribed hydrocortisone for contact dermatitis, and sent me back to work with the animals. 3 days later, it has the telltale ring of ringworm and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. Veterinarian here. This is the worst I ever had, but not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examined the kitten, and sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals to, so I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good, because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google, and it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassiere supported tit through the neck of the muumuu to show me the ringworm lesion on the top of her left boob. Yes, that's a ringworm lesion on your pendulous breast. Now please put it away. Muumuu, appropriate attire for the vet's office. My sister is a paramedic. One day she and a team are sent to house. A man had called about a broken arm. I don't know how he broke his arm the first time, but had read somewhere on the internet that if he just kept breaking his arm then the pain would go away. He had tried around 3 times by jumping up and smashing down his weight on his arm, and it shocked everyone that he proceeded after the first time. In the end the guy had to get 4 surgeries on his arm, but my sister isn't sure if it wasn't eventually amputated or not, since she was pretty sure by the look of it in the x-rays that it would have to be. This is somewhat related, but I'm not a doctor. The only time I self-prescribed was when I thought I had rhabdomyolysis. Never had even heard of it before. I woke up that morning feeling like I'd been in a car accident, had done a very heavy workout 2 days prior, and literally wondered why it was the worst soreness of my life. I didn't start doing any web stuff though until after I went to the bathroom and realized my pee looked like Coca-Cola. What's funny is even going to the I was thinking, this is a total waste of time and I'm going to be laughed at by a doctor today for being a dumbass who looks up crap online. Then I spent the next 5 days in the hospital and went through 70 IV bags before I was finally discharged. I'm sorry this doesn't answer the question, but it's related and I'll say up front. My fiancée is a nurse and she and her nursing colleagues have all agreed I was well within my rights to be the butthole in this scenario. I'm usually extremely polite to everyone, but you know, pain. I went to the emergency department because I couldn't move anything above my waist and was in horrific agony. For no reason whatsoever my back stopped working. This was on Christmas Eve and left it till the 28th to go into Tridge and I'm waiting around for hours. Still in pain and trying to move in any way. Eventually Tridge nurse shows up. So, what's the problem? Back is in agony. Can't move. I haven't injured it. Think it's maybe a slipped disc or trapped nerve or something. I'm not sure. Are you a doctor? You're not, are you? So don't come in here trying to guess what it is. Okay. Are you a doctor? She stormed out without saying a word and the doctor came in 5 minutes later. Took a look and determined some swelling had trapped a nerve. Heavy duty diclofenac and I could have danced 30 minutes later. Yeah, no reason for that nurse to be snarky. She had it coming. As a twist, not a doctor, but I once went into the doctor for what turned out to be a less common skin virus. The doctor took one look and said, "Holy cow, I just read about this on the internet, Christmas tree rash." As a patient who looked up his odd symptoms online, never tell your doctor you looked up your symptoms online. Had odd reduction of feeling in my pinky, ring finger, half my middle finger, along with that half of each hand. Also reduction of feeling from halfway down my thigh and below. Also Elhermet sign. Check for spelling. Saw pretty dead on clues for transverse myelitis. Lesion on the spine. Got sent to a neurologist who basically told me that I was feeling my symptoms because I sketched myself out searching online. Took me and my parents crawling up his butt to get an MRI scheduled. Lo and behold, a nice glaring lesion on my spine. C4 and C5. He told me he would learn to trust his patients more from then on. Hey, I have this. Only it took 2 years and countless doctors for them to even look back at the MRIs they took to go, oh, there is a lesion there. Ha, blah. I hope you've recovered well. I have a spin on this topic. I had a searing pain through the left side of my chest. It was excruciating. It started as a dull pain but quickly felt like my chest was on fire. I thought I might be having a heart attack, but I didn't die and the pain kept building. While lying in bed attempting to sleep and literally crying from pain, I googled my symptoms. My self-diagnosis, shingles. The next morning I went to the doctor and told him what I thought the problem was. To my surprise, he opened a web browser and went into exactly the same site I'd looked at the night before. And sure enough, shingles. I thought I might be having a heart attack, but I didn't die. Me in every situation where I have extreme pain but also do nothing about it. Worst self-diagnosis as a doctor. I was in a rough part of training, not sleeping, working 90+ HR weeks, and losing weight. I crawl into bed after 40 hours awake at the hospital, too tired to eat. I notice my laptop on my lap is twitching. I realize I can feel my abdominal aorta pulsing. I freak out thinking I have an aneurysm. 0 risk factors. Then realize I am hungry and tired and thinner than I have ever been. I sleep like the dead. Not a doctor, but I worked a death scene where a woman was using black salve to treat her skin cancer. Half her face was gone. Her daughter explained that the doctor told her he could remove all of it and gave a really good prognosis, but she was on board the internet's bandwagon and she applied this horribly corrosive crap that doesn't work until the day she died of cancer. You could see her teeth through the hole in her cheek. Her computer was still pulled up to the FB boards where people were telling her it's doing exactly what it's supposed to, just keep to the protocol. It was horrifying. Black salve is literally acid, but it's organic SMH. Check out Miles Power on YouTube. Not a doctor, but when my wife was having some odd symptoms and feelings, she started researching online. All her co-workers told not to do that because WebMD will have you thinking you have cancer. She did have cancer. It took about 7 months of repeated visits to various doctors before someone finally did a CT scan. She had cancer. If you think something is wrong, keep pushing. When her cancer came back, she had to guilt trip her oncologist to do a PET scan because he said it was too soon for it to come back. It was back. So if you know something is wrong, keep pushing until you get the right answers. Oh yeah, happened to a friend. She has a rare form of non-Hodgkin's lymphoma and has for years. Suddenly had weird symptoms for 6 months and then was diagnosed with Hodgkin's lymphoma as well. I always tell her now that with her WebMD is right. It really is cancer. Also, good for your wife to self-advocate. The inability to do that literally kills people. Just graduated medical school a few weeks ago. The most frustrating are the concerned parents who buy into all sorts of myths regarding vaccines. Especially frustrating are the parents who refuse the HPV vaccine for their daughters and sons, not based on any misguided health concerns, but instead due to beliefs that it will encourage their daughters to be sexually promiscuous when they're older. Late to the party, but may as well add this. I was working with a physician and we went to see a patient who insisted that he had tiny fibers and worms bugs coming out from his skin. He had extensively googled his symptoms, self-diagnosed with Morgellons disease, and had even gone as far as to join a support group. He was extremely articulate and intelligent, but when confronted with the fact that Morgellons disease is a delusional parasitosis, he acknowledged this but couldn't grasp that a delusion would mean that he is perceiving something that is not actually there. Delusion equals fixed, false belief. I remember seeing an emergency room show where a building contractor had a fall on a building site and turned up to the OR a week later complaining of a temperature and nausea. He'd broken his ankle and had made a makeshift cast from concrete. The cast was removed to reveal a nasty, red-looking foot. He was recast, placed on antibiotics and sent back home after it looked like everything had settled down. He returned a couple of days later feeling worse with his temp way up, etc. The doc asked him, "Did you sustain any other injuries during your fall that you didn't mention?" To which he answered, "Oh yeah, I cast my side, but nothing serious." The doctor asked to see the wound, and the man removed his shirt revealing a very infected 5 inches cut that had been closed with makeshift copper wire stitches that the patient had applied himself with tools from his building site. I was just astonished when I seen this, lol. Reverse experience. I went to the OR for anaphylaxis, obvious distress, and was made to wait an hour before seeing a doctor because the triage nurse and desk lady didn't feel it was important. Or maybe they thought I googled the symptoms and was able to sustain fake tachypnea, tachycardia, clamminess, and a dusky color. Yeah, I've posted a lot about this. It's a bit traumatizing. I had a patient come into the clinic who insisted she had radiculopathy because her feet were numb and painful, and she wanted a surgical evaluation. I asked her why she felt that way. The only thing she could say was she looked it up on the internet. She was very aggressive about it, saying she needed an MRI and she was mad that her PCP didn't order one. I explained to her what diabetic neuropathy was, and she insisted it wasn't that. I told her that the fact that she had diabetes, the stocking glove pattern, and the fact that at least 2 doctors at her PCP office said this was diabetic neuropathy meant she didn't need further workup for back surgery. She threw a fit. I went to my doctor about a month ago, had a spot on my back end that had me a little worried. Marizo, since my mother had skin cancer on her hinny. I had also recently been around someone who has shingles. Prior to this, I had pain in my foot and went online and found it to be plantar fasciitis. When I saw my doctor later that day, I told her what I found on the internet and she said, "Yep, that's exactly what it is." Now, I joke when I am nervous, and I was plenty nervous due to the incidence of melanoma in the family. So when I went in to see her about my spot, I told her that I had been on the internet and I was pretty sure I found out what it was that I had. She asked me to elaborate and I told her that I was pretty certain I had shingles cancer. She just about fell out of her chair laughing. One time I accompanied my wife to the doctor's office. She had looked up her symptoms on the internet and diagnosed her calf pain, a strained muscle in hindsight, as peripheral artery disease. The doctor was not in the least sympathetic or tactful in explaining that pad doesn't appear suddenly during an exercise session. She felt humiliated and immediately changed to a more sympathetic doctor. 20 years on, the self-diagnosis errors continue. This is kind of the opposite, but still amusing in a sad, George Carlin was right kind of way. I was poor, but also a responsible adult, so I was at the free clinic down the block from my work for a routine exam. In walks an acquaintance with a woman who was clearly her friend, but unknown to me. They come over and we make introductions. The acquaintance's friend is called shortly before I am. After the usual song and dance, I head back out. I see the acquaintance, now alone, and go to chat a bit more. She explains that her friend was sure she had a UTI, but it turned out to be gonorrhea. She was back asking how long she'd had it, and trying her damnedest to work out where it came from since her long-term boyfriend couldn't possibly be the source because he would never cheat on her after the last time. I ask who the BF is, and it's a sleazerbag in a band that was trying to try it on with me a few months back, but I was not into him. I had no idea he had a GF, or I would have given her a heads up. Here she was, adamant that she must have had gonorrhea for several years but her immune system suppressed it until she recently got stressed out. I told the acquaintance about his not so distant attempts at cheating with me, so she could maybe get the woman to see reason. I thought it would be better coming from a friend rather than a stranger. I learned later that the poor woman had gotten the nickname Mrs. Picklesworth after getting drunk at a party and masturbating with a pickle in front of a dozen or so partygoers before eating said pickle. So I mean, I can understand the UTI assumption, but not believing medical professionals over a serial cheater really burgled my brain. Rewind to 3 or so years ago. Co-worker started missing periods, gaining weight, mostly around the stomach area, sick most mornings. Another co-worker provided pregnancy tests. All came back positive. A trip to her alternative practitioner left her diagnosed with a borderline celiac gluten intolerance disorder. Ate egg and bacon sandwiches for breakfast every shift but refused to touch flour. 75% of her job at the time, as it absorbed through her skin and made her bloated, sick and irritable. Left work early one day with kidney stones. Left the kidney stones on her toilet floor to die where paramedics later revived him and DHS got involved. She is never allowed custody of her kidney stones. Has mentioned several times about suing the local clinic for not telling her she was pregnant. The same clinic my GF gets told to pee in a jar every time she has so much as a sore throat. TLDR. Co-worker was pregnant. Told so by everyone. Denied it and found a charlatan that gave her alternative advice. Now wants to sue for not being told she was pregnant. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.